open that up and then go to already downloaded Teams, but you would go from here. And then there's a little download button that is usually here that I'm sure you clicked on. And then that downloads it to your computer so that I can control your computer. Then you close that out, go there again, go to Outlook. And then the first thing that we'll do is go to Reach Support. And scroll down here. Okay, so you've saved your password, and this is WebPT Reach. So WebPT Reach basically is a way to monitor all the patients that we see. They'll get sent a questionnaire after their initial evaluation saying, how likely are you to refer us to a friend or family member? That'll convert into your NPS score, and we track those, the comments associated with those, everything like that. So if you do get a negative response, I would recommend talking to your clinic director about it, but also making sure to talk to the patient about it too, because they have a concern, obviously, and if you address it, then usually they're super happy about it. So whether it's what we call a detractor or promoter, you'll basically get different feedback as it goes along. I think a promoter is anything rated 7 to 10. Neutral is like 4 to 7, and then a detractor is anything below that. And usually they'll leave comments too. So most of the time, your clinic director will be the one monitoring all this. So the next thing that I want to show you is our WebPT HEP program. So we'll bookmark this one too to the bookmarks bar. And again, if you want to toggle the bookmarks bar on and off, it's just right there. So WebPT HEP, the big thing for this is to search for your patient's name first. So let's pretend that this is our patient. You look at active care plans, and once you find the care plan that you want, you click on the little stylus and piece of paper. So I've got one exercise in there right now. As you go along, you can just click add, or you can drag it on there, whatever is most comfortable for you. Then you click on the picture, and the picture will tell you basically you can play the video, and then you can also do sets, reps, resistance, comments, all that sort of thing. And you can edit all of that at any time. Once you're at a point where you have kind of outgrown these exercises, I would just move them to a second phase like that, just to get them out of the way. This will allow you to like maintain your archive here, and also have the exercises that the patient can currently see. So the patient can only see the ones that have the blue dot there. These they won't be able to see. Yep. And if you get to a point where you're like, oh yeah, they had a flare up or something like that, you can move it back in there. If you were to delete it, you would lose all your like sets, reps, comments, all that stuff. Okay. I'm gonna have you move your cursor kind of up there. There we go. Perfect. So once you're done creating the home exercise program, just hit update care plan, and then you'll notice that your care plan has been created successfully. Patient will be emailed access shortly. If they go through the portal and they follow the email instructions, that's all you really need to do if their email is on file. If it's not, then you can press the print button here, and then it'll print out a paper copy for them. If they want to just look at it on their phone, they can just scan this QR code and do a screenshot of their phone. Now, if it's a Medicare patient that is doing remote therapeutic monitoring, which we'll get into a little bit later, you do have to go to the messages section and then go to new message and then add in the person's name. And then the day after the eval, you would just say something along the lines of, something like that. And that's our requirement for RTM codes. They may message you back and forth, but historically, patients don't message as often unless they're really spaced out. So, like, say they're coming in 2 times a week, or I'm sorry, once every 2 weeks, they'll use this a little bit more. If they're coming in 2 times a week, then they won't use it as much. So that's everything within the WebPT home exercise program. It's pretty straightforward, and you can pretty much just play around with it, and it's pretty intuitive. So we'll close that one out, close that one out. Now, the other one that we'll sign up for is Photo. Photo is our outcomes tool that we use to collect like low back disability index, that sort of thing. Your login name will be this, so IRG / first initial last name. And then again, we're going to save this, but go ahead and put in a security question, security answer, new password, and then confirm the password and then hit update. Yeah. Okay. And we're just going to close that out for now. And then go ahead and put in that IRG / first initial last name, and then the password that you just created. Then hit sign in. And then this one we will save. Okay. I'll have you move your cursor again. Perfect. Okay, so this is what we do for our patient outcomes. You won't have any currently. But what you would do is change it to the clinic that you're at. And that kind of locks in the dashboard to this clinic. And then you go to open episodes, and it'll tell you how many open episodes whoever is selected has. So you'd search for yourself, click on it. If you had any open episodes, they'd be right here. So to give you an example, we can search for, I'll show you all the open episodes. I'll say when the intake was created, and then it'll give you these options. So if it doesn't have an intake and it's a person that you're seeing today, you can just go to the launch button, and that'll launch the survey on your computer. You can also, if it's a couple days before and you're helping the front desk out, you can email it to them. Or if they're right in front of you and you want them to fill it out with you there to answer questions, just click on the QR code, they scan it with their phone, and then they can fill out the questionnaire right there. So after they're done with that, you can click on the intake, and it brings you to this screen where you can find their score right here. But another thing that's kind of nice is it'll give you a lot of their background history, kind of what's going on. It'll also tell you where they're at and where they're predicted to be at visit 12. And then you can also scroll all the way down and see how they answered their question and how they answered all the questions, and then what the end goal should be. So intake and then predicted. Then you have a couple other demographic information down there, and then if you're looking to correlate it to a recognized outcome tool, you can see that listed right down there. So usually I'll have that open while treating patients. It'll just kind of, it'll just kind of live up there. And I'll just open that in the morning. So I'll have my email up, photo up, and then the last one that we'll look at is clinician. But before we do that, I want to bring your attention to a plugin that we have called TextBlaze. And I'll have you sign up for that. Use your IRG email. And then your password can be anything. Okay, we'll skip the tour. Close that out. Okay, so TextBlaze will always be running in the background of a Google Chrome browser. The way to add something to this, you hit the plus sign. That'll bring up what's called a snippet. So you'd rename this like subjective, and then your shortcut could be like \S1, and then basically you replace this with whatever you're wanting to auto-populate. So say every time I treat a patient, I say patient reports with signs and symptoms of, like, I write that phrase all the time, right? So this is auto save now. So anytime that I put in \S1, that pops up. So you can create whatever you want with that. Okay. So the last one that I want to show you is going to actually, let me do this. So that's going to live right there. Okay, so the last thing that I want to show you is going to be Clinician Insight Go. So any link that you're looking for is usually on this homepage. You just hit the home button. So I'll click on this and then save that to the bookmarks bar. Now your username is going to be first initial, last name, .intg. And then your password is going to be change me, no spaces, all lowercase. Okay, now you'll need to change your password and we'll save that. So change it to a new password that fits those criteria right here. So you can do however you want, and you're going to need to change it every 60 days, I believe. So you'll need to change it a couple times. Yep, and I'll update the password here. And that's one that if you ever forget your password, on that login screen, it'll say forgot my password. And that's how you would get it back. If it's you forgot your password to get into your computer or something along those lines, you would email support@irgpt.com. All right, so here is the EMR. It's very similar to like WebPT. It's a browser-based EMR, so you can run it off of your computer at home. You don't need a VPN. It's protected wherever you're at. But you want to make sure that your clinic is selected. You can see everybody's patients here. Scroll down. Take that away. Go just to yourself. And then if you want to look at the week, you just do weekdays. Now, the key with this is you have to click and drag to see your patients. If you want a little bit more visibility, so if you're like, oh yeah, I need to shrink this down a little bit, you can go up here and shrink it down using that. Okay. So a couple things. You can get to this column by clicking on that. And then to get to a patient, click on that. And you can see a little bit of their demographics, but to view their chart, you click right there. Now, this patient has not yet arrived, so this is what it looks like. If they have arrived, you'll see the note pop up automatically, and then you just document from there. So if you're doing like a chart review of like, oh yeah, I wonder what this person is coming in for, you have your initial evaluation is always going to live here. Your last note that's been documented on will be right here. And then all the other notes are there. If for some reason you don't see all the other notes, like there should be 8 of them here, you can click the all button and then go down like that. Okay, so let's look at an initial evaluation. So there's a lot of different ways to utilize all these spaces. As much as possible, try and add them into the areas where they're like boxes and not so much the free text side of things. As you're first starting out, you can write things in here as you're talking to the patient, and then start entering them in down here as you get a little bit more comfortable with EMR. But what I would say is just try and migrate all that information down here as much as possible. So you can see this person put a lot in the subjective, date of onset, and then a couple other things, primary functional limitation. If you see a red star, that means that it needs to be updated. Its cold due date is 5/19. So currently it's beyond that and needs to be updated. And then these goal due date is 6/9 and 6/30. The easiest way to do this, if at all possible, is to keep all the goal due dates the same so that when your plan of care is due, you can update all the goals at the same time, do a progress note all at the same time. This is where you would put your photo score. So you would go back in, pull up that report, put the photo score right there. In the objective section, ideally, you want to use all the boxes. This is not an ideal way to do it. Using the boxes allows you to create goals out of the different objective measures that you have. Evaluation complexity, you can choose whatever you want throughout here, but you definitely need to remember what your complexity of decision making is, because you'll need to add that into the procedure section later on down the road. The assessment area is an area where you can put whatever you want in the summary, similar to the subjective. There's a bunch of boxes that we want you to enter information into. A lot of this is pre-populated information, so you won't have to write a majority of this, but this is something that you'll enter in yourself. You do not have to go into this much detail. A lot of it is just kind of summarizing what you did. The plan, again, you can do 2 times a week for 8 weeks or whatever your plan is. But there are different areas that you can easily put in all these things so it's not one big paragraph. And then the procedures section, ideally, we're trying to stay away from anything that looks like therapeutic exercise, like something. This person did a very good job of not utilizing the therapeutic exercise or like the general thoughts. But one thing to be mindful of is patient education and self-care. You really want that to be a different version of patient education that has a CPT code of therapeutic activities. This is actually a little bit different patient education. I'll show you it a little bit later. It'll make more sense when we go through like an actual eval that's all blank. So yeah, that's just kind of the overall layout of an initial evaluation. But we're gonna do a blank initial evaluation, and you'll learn how to do it a little bit more streamlined than what this therapist chose to do. So we go back. So we're going to take a look at your first initial evaluation here. Click on them. Open up their chart. You can see appointment has not yet arrived. If it ever says that and has a start button, don't click start, and this will pop up saying you don't want to do this. The reason that that's the case is if you open this and then the patient doesn't show up, you'll need to message Ben Boyle and he'll be able to remove the note, but it's essentially like deleting that documentation, so that's why you can't just undo it. But for the purposes of training, we'll open this up. So this is what you'll see when you first open up your initial evaluation. It'll give you a bunch of templates to choose from. You're just going to go to the musculoskeletal evaluation templates, and then look over here. It says cervical. So I'm going to click on cervical there, and then click apply. So it'll give you a bunch of options: shoulder, elbow, wrist, hand. For the either if you're doing lumbar or head and neck, you really want to keep those unchecked, because if you were to check one of those and you do like a objective cervical screen, it'll say like on the right side you have right rotation and left rotation. Like, you don't want that option in those situations. But because we don't know which side is the effective side, we'll go right and left for all the ones: shoulder, elbow, wrist, and hand. And then you click apply. So after you've applied that, you go down the list and see where there's yellow and blue. Yellow is you absolutely have to put something in there. Blue is optional. So if this is a yellow option, you're going to change that to pick any one of these. Or if you prefer, you can just highlight and like put in the date, something like that. You can text anything in here, but to save time, usually it's easiest to just kind of click through or enter in the text. If you accidentally click on something, you can always unclick it by doing that. And definitely don't feel like you need to add in all the information that's in here. That'll make a pretty clustered note and a lot of information in there. So just only do the things that you would normally do in a note. You don't need to over document. That basically just allows for more opportunities if somebody is looking at it to pick it apart. So try and keep it as concise as possible, while still getting as much information in as you feel like you need. The summary area up here, what I like to put in there is something along the lines of like the patient's relationship to like activities, like family members, sports, things like that. So you could say, something like that. Everything else that you would typically write in there is probably going to be down here. So don't write a whole paragraph up here and then copy all those things in up here. Just try and do it once, if at all possible. So we're going to pretend that it was insidious onset, gradual, condition unchanged. The goal is to eliminate symptoms, status looking good. And the first thing that you'll probably enter in is verbal pain rating. So let's say that she has pain 7 out of 10. You would right click on this verbal pain rating at worst, make this a goal, and then you could have the desired goal be 0, or you can do something like less than 3 or something along those lines. And then the goal due date, this is where you kind of have to determine, all right, I'm going to do this plan of care for 8 weeks. So click once, click twice, go to the 24th, that's about 8 weeks, and hit apply. So now you can see that a star popped up right there, and you can hover over it. You want less than 3. So looking at this, when you put in that initial goal due date, that means that every time you make a goal, that goal due date is going to pop up. I would highly recommend just keeping that goal due date unless you have a really good reason to change it, just so that all your goals kind of expire at the same time and you're getting it all done at one time. You can kind of click through pain, anxiety, and again, yellow is you absolutely have to have that in there as the bare minimum for compliance. And then working on down the list. Next thing is primary functional limitation. Patient is unable to, let's say, check her blind spot. And then make this a goal again. Now the trick to this one is you just copy, paste, and then just remove the UN. And notice that your goal due date got auto-populated there. Click apply, and you've got another goal. Usually I try and do about 2 goals here, and then as you get to the photo score, you go back into your open episodes, open up that report, say the report said 50, and then you can use the predicted goal as the desired value. So if it predicted that you'd have 64 and 12 visits, you can just do that, click apply, and that creates a goal there. Now the objective section, you want to try and use these blue boxes as much as possible. Now, when you're documenting while treating the patient, you may feel the need to kind of add in notes in the summary and then transfer it down here. But if you just leave everything in the summary, you're never able to make a goal out of them. So let's say that you're scrolling down here to cervical active range of motion, and cervical extension was 25, cervical flexion 60, lateral flexion 45, rotation is 60, and rate is 10. So this is your 45 and 10. So let's say that this is your big one that you want to monitor. You can right click and you want this one to be 45. Okay. So that creates a goal. And then you can do as many goals as you want, but remember when you get to progress note time or discharge time, you're going to have to update all those goals. So I probably stay in the neighborhood of like 6 goals total, functional limitation and goals down here. But you can do probably up to 10 or 12, depending on how many you think are important. So continuing to go down, evaluation complexity. This is a required field. So they had no personal factors, but if you wanted to change that, you could. 1 to 2 body systems, stable condition. I'm going to say that they're a low complexity. Now, you can always choose whatever you want here. It doesn't necessarily tie into these 3, but if you had none, 1 to 2, and stable, and you happen to put in like a high complexity, something like that, you're probably going to need to document over here what made this so complex that your clinical decision making is high, but it's possible. Now, another thing to do if you're really trying to be concise with your documentation, in the notes section, you can say what body part or body systems are affecting this. So musculoskeletal system, and cardiac or something along those lines. Explain the stability of the condition, that sort of thing. So after you're done with that, you keep on moving down. This is the assessment area. Cervical diagnosis. Basically, what that is your physical therapy diagnosis. So you could say like upper something along those lines. You can put some things in the summary area, but you can also just put everything in here. And then looking on down, you want all these things entered. So you include all displayed items from this area. And then all that is already pre-populated, so you don't really need to touch that. Plan, like I said, I would just include everything through here. And then home exercises, you can say through WebPT, something along those lines. And then since this was going to be 8 weeks, we're changing that. And then if you look up here, this is the patient's age. That says 65. The next thing that I would do is go over here, click on authorization. If that says Medicare dash, or I'm sorry, MED dash Medicare, or anything that just says Medicare, that that's the sign that you can bill RTM codes. And we'll go into that a little bit later. But if it just says Medicare without like AARP or Med Advantage or anything like that, you're okay to bill RTM codes from there. And if that does fall into that category, you're going to want to click all these boxes, which are RTM code justifications on the initial visit. And then the procedures, you just click the add button. And then you are going to get a whole list of options. Get a charge ticket, evaluation. Remember, we had low complexity for our choice, so we're going to click that. And then procedures. Let's say you did a manual therapy. This is the patient education that I was talking about before. That's the one that you want to use, not that one. So I'll favorite that one. So you don't want to use that one. That'll bill a little bit differently. And then you can go back. And then a lot of the things that you'll want to use will fall under the treatment activities tab. And then strength training activity. So we'll go click on one of those. And then functional strength activity, click on one of those, and then click apply. And that'll pull everything in there. Now, if it was a Medicare patient, you do not bill any of the remote therapeutic monitoring on the first visit. I'll send you the timeline of when you would bill that, but this is where those are located. And the timeline will tell you which ones to bill at which times. So looking down here, you have all the procedures that you selected. So you can see that the CPT codes are right here. And notice the patient education one is therapeutic activity. So patient education, something like that. Or you could say like went over home exercise program and prognosis, patient verbalized understanding, something along those lines. So looking here, it's very common for you to have over 45 minutes of total treatment time. Anytime that you're devoting time to a patient's case or using your clinical skills to determine anything. So whether you're talking to a doctor, filling out case information, anything that uses your license, you can bill for that. So a lot of the time, this will not stay at 45 minutes. It'll go above that. You can either modify that here so that that'll change to incorporate that, or on the next page, it will also do that. For some reason, it's not letting me change that, but that's the process that you'd go through. Now, you also want to make sure that when you're looking through some of these units, you're trying to stay as close to all like the cutoff points as possible. So like 8, 23, 38, 53, all those are typical cutoff points for CPT codes with commercial insurance. Insight Go will actually change your whether it falls under the Medicare rule of eights or a commercial insurance. So I always recommend people follow the commercial insurance and then let Insight Go change it to the rule of eights if it's appropriate. So this one, 15 minutes is probably not a good amount of time because you're going to get paid for 8 minutes or 22 minutes. You're still going to get 1 unit. So I would try and get it as close to 8 as possible. But if you're watching the clock closely and you're like, nope, yeah, it was absolutely 16 minutes of treatment time, perfectly fine. You can leave it that way. Just put some thought into how you're distributing your charges. So in the next screen, if I hit sign off, it won't let me because it's not arrived yet. But the next screen would be where you would modify some of those units. Now, after you finish this, it'll ask you to enter in a diagnosis code, ICD-10 code, and then sign off on your note. So that's pretty self-explanatory. Just try and stay away from any of the surgical codes. Insurances don't seem to like that. Knee pain, shoulder pain, all those seem to be more widely accepted, and you can put more than one ICD-10 code in a note if you choose to. Now, one other thing that you need to do after you've finalized your note, go back over to the case here, and then you're going to scroll all the way down to the bottom, add a plan of care progress note. So if it were a Medicare patient, you do plan of care. If it's a commercial insurance, it'll be just a progress note. So see how if I did plan of care, it would be plan of care and progress report. Since it's just a commercial insurance, we just need to do progress report. So I'll delete that. Effective date is today. You set your plan of care for 2 months or 8 weeks, which is about 56 days. And then visits are always going to be 10 visits. What this does is it creates an alert for the front desk so that when you do need to update your plan of care, they know it and they'll reach out to you. You hit save. And now that is updated as well. Okay, so that is how you would populate an initial evaluation. I'm going to pull up a daily note and show you that, and then we'll go over questions after that. Yes, yeah, absolutely. Yep. Yeah, no worries. Okay. So this is an example of a follow-up visit. So this is what it'll look like. You have your summary that got pulled through, and then you have all the information that you've written in the past. So one couple things that I want to highlight. Let's say that you have some of these goal due dates that are expired. Number one, you should always hit the include all displayed items in the area. Do you see how it went from green to black? You can go here, right click on this, edit goal, and then let's say that it was from 5/1 and you need to change it to 8/31. You would change the goal due date, goal progress would change to any one of these, and then you'd hit apply. Or you can just click on completed if it's completed. If you don't click on this, then none of this text will show up in your note, and it's going to look a little different. The goals will show up and not the text. So you always want to click that in. Anything that you see that's kind of like this green text, you want to make sure that you get that into the note. Okay. And then the assessment part, this person chooses to leave this in and then add in this. What I would recommend is only putting in the information from the day of service. That way, when someone screens out a note or if there's an audit or anything like that, it's very clear what you did on that day. Plan, if you're doing a discharge, you would just change this to all goals have been met, patient will be discharged. If you're adding on as a progress note, you go to add, and then it's got a bunch of options for plan of care. I would just go to plan of care here, click on that, and that pulls in all your plan of care stuff. And then procedures, you would just, as you're going through, you just kind of click on them. You're like, yep, we did that, we did that, we did that, and we did that. Okay. So as you're treating the patient, you can kind of click down through it. Yep, you're going to want to put all your exercises. This is like your flow sheet. You also want to put in how much time you spent with the patient doing that exercise, them doing the exercise, and then you setting it up. So you spent 6 minutes on table slides, 20 repetitions of that was active time. The rest of it, we're going to assume is like setup time, you demonstrating, all that sort of thing. So that's how that all gets split up. And then you would want to change these to something probably closer to the 8-minute mark. And then when you hit finalize, it'll bring you up and add all those units together. And that's it. So that is oh, I'm sorry. And then you go back here and then scroll down and then add in your plan of care from there. On a progress note, where you have to update the plan of care, or well, say like all of your goals are red, like they need to be updated. That probably means your plan of care needs to be updated too. So if you're doing a progress note, then you'd add another plan of care to it, or you'd add another progress report to it. If it's a Medicare patient, you would add a plan of care to it. So I mean, that's a lot of information for sure. I recorded everything and I have a tutorial that you can look at any time. So please utilize that. You can also message me at any time if you have any questions or you're working through documentation and you're like, hey, Brad, can you take a look at this? I can certainly do that as well. but I think you'll find that it gets pretty easy as you start to see more patients. Like, it's pretty self-explanatory, and it won't let you, like, do something that's not compliant. Okay. So any questions on anything? Um, so the documenting each exercise is, yeah, basically just a flow sheet of what you did. Um, so you can cluster them, like if you're doing a bunch of band exercises, you can put them all in one if you wanted to, but you definitely need to have the amount of minutes that you spent on that exercise, you put that in there. Now, I don't necessarily want, yeah, one exercise, cluster of exercises, whatever you have in that space. I can bring that up again. So something like this. Like, you spent 6 minutes on this exercise, which is kind of like a general exercise. It was basically these two. Then this exercise right there. So that's how you would need to do it. Now, manual therapy is a little different. You spent 25 minutes on manual therapy. This is what you did. That's going to be coming from the, see if I can find one that's open. There we go. So you don't necessarily have to go that far into detail, like finding all these. You can certainly just do the add. If you want to do that, that's great, but it does take a little bit of time to find those. You can use the search function and search like tubing. And correct. Correct. Yep. Yep. Which is kind of what I've defaulted to. Let's see. Yeah, you go to that. Um, treatment activities. And then I would just use these and then just free text the exercises that you did in there. They just can't be the same name from a programming standpoint. So they mean nothing. They're just different titles for the same thing. Oh yeah, the remote therapeutic monitoring codes. So if we Okay. Okay, so every once in a while, you might get something like this. You just interact with it, say yes or no, and then hit submit. And then based off of that, sometimes other messages will come up. This is just kind of like a questionnaire for me. When you have time, just click there, fill it out for me, and that'll give me a little bit of information about you. And then sometimes it'll trigger other messages and other things to be sent as well based on how you respond to that. So I will send you the RTM code description here pretty soon. But basically what it is it will you'll treat a Medicare patient that's appropriate for RTM codes, and then after the 16th day from the initial evaluation, you have 3 codes that you bill, and then 30 days after that billing period, you bill them again. So, like I said, I'll send you kind of the outline of it. There we go. So 16 days after, you build these 3 codes, wait 30 days, and then those codes. You can do the 30 days as many or as long as you see the patient. There's a description on how to do it in this tutorial link. This is the presentation of what I'm currently doing. And then here's a photo link. So if you just click on this, it'll bring up window or Microsoft's version of like YouTube, basically. And then if you just look through the timestamps, you can pick out whatever you want. You can also just fast forward as well, but it'll go through everything that we just went over in case you forget or need a refresher. It'll be right there. Yeah. So RTM codes basically are reimbursement for having a home exercise program platform that has two-way communication that we can monitor patients with, which is our WebPT, HEP, and Reach. Messaging that patient the day after their evaluation kind of checks the box of us trying to communicate with the patient and opening up a line of communication with them. It also reimburses us for things like all the outcome tools that we use and the database that we have to pay for. Medicare is reimbursing us for that as well. The WebPT HEP is tied directly to the patient's chart. So yeah, as much as you can use that, that's ideal. We don't really like the information coming from anywhere else. Yeah, yeah, no problem. So to message me, just click on that, shoot me a message, um, and then I'll get back to you as soon as I can. I might need you to share your screen just like you just did. So you just go up here, share your screen, and um, then I'll be able to help you out with notes or computer problems, things like that. The you have any login to your computer problems, you would go to support@irgpt.com. Any other questions, you could probably shoot a message to me. Anything else that you can think of? Okay, yeah, what I would recommend doing before your patients come in the afternoon is just play around with clinician and like look at charts and look at the documentation, see what other people are doing, that sort of thing. That'll give you a good idea of kind of the flow of things, what information to put in, that sort of stuff. All right. Yeah.